Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truth for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Channel, the right show, but Dr. Joe, unfortunately for us, but fortunately for him, is in Australia enjoying a very nice vacation. I'm pretty jealous. So he gave me this opportunity to host Wednesday's show, and I'm happy to be here, and I'm really excited to actually have my business partner, Dr. Kurt Doolin, one of my best friends, my mentor, and somebody who really has wanted to join the show for a while, and it worked out well that we could have him here tonight. So welcome, Kurt.
Hey, Jeff.
How is everything going?
Perfect.
Are you alert and awake? I know it's a little late for you.
I am. I'm fired up. I've never done live radio before. I'm not even allowed to sing in the shower. So.
I think you're going to do fine.
Okay.
You usually play it by ear pretty well. I'll tell you, Kurt, what Joe and I always try to accomplish during these shows is obviously to educate our listeners, and there's, as you know, a lot of similarities between our office and Dr. Joe's, and it really comes down to what's the best for our patients, and whether it be the latest techniques and technology, we want whatever we can do to help our patients have the best experience in our office, and you taught me that. We've continued to do that, and I think that really we want to show, even people talk about tonight, some of our new maybe toys, some new technology in our office that is helping us do a better job. And so first, before we get started, why don't you tell us a little bit about you and your dental career and life in general?
Right. Well, I grew up in this area, been here all my life. Auburn, it was Auburn Heights then, Auburn Hills now. Went to college at Michigan State University. Unlike you and my wife, who are the blue and yellow people, or whatever they call it.
We've got a big game coming up this Sunday, so get ready.
Dental school at the University of Detroit, postgraduate residency at the University of California at San Francisco, implant training at the Misch Institute, aesthetic dentistry training at the Las Vegas Institute for Advanced Dental Studies, and live happily in this area with my lovely wife, Marcia, and our three teenage and young 20s daughters who are college and high school age. So, and as you know, practice high-tech, hopefully, dentistry every day.
It's true. No, we definitely pride ourselves in really all the advanced training that we take. And like I said, Dr. Joe and I we share a very similar philosophy in the fact that at the end of the day, if there's something out there that's going to help us do a better job for our patients, we want to learn it. And, I want to, introduce, I guess, our topic tonight because I know it's something you're passionate about. There's some new types of X-ray technology and imaging out there that is just unbelievable. And I got to be honest, as much as I love technology and as much as I, sometimes push you in these directions, you dragged me down this road, and with the new cone beam 3D imaging technology. And why don't you tell a little bit about why this is something that is going to help us and help our patients?
All right. Well, way back in the 80s when I graduated from dental school, I went on to postgraduate training in California, and it was basically a hospital program that was heavily surgically influenced. I did surgery nearly every day for 1 year. And at that time, the field of dental implantology started to open. to us where we could replace missing teeth with permanent fixtures that were embedded in the jawbone and crowns or bridge work or dentures placed on top of them to help our patients chew real food instead of the soft stuff that they were forced into. So we
actually replacing a missing tooth. Actually replacing missing teeth,
yes, from a single tooth to a full arch. So it was as many different engineering schemes as you could think of. They are out there. So what is involved in that is the need for very high quality imaging and x-rays. And what I started seeing happening in all my training and all of the seminars and classes that I continually go to, because I am kind of a dental...
You're a nerd.
I'm a nerd. It's fine. I embrace my nerdishness. But we started seeing, instead of the standard two-dimensional flat plane x-rays that I think everybody's used to seeing those images in our world today, we started seeing... the use of medical CT or CAT scans, as we all hear in popular literature. And what that really means is that we take many X-ray images and layer them on top of each other and use a computer basically to sort out those images and stitch them together. It gives us views that were previously unattainable. We can see things in 3 dimensions now instead of 2 dimensions. Now, that may not sound like much, but if you're a surgeon, it's always good to know what you're about to drill a hole in.
That comes in handy.
It does come in handy.
Before you go on, I want to make sure that we clarify, because I think a lot of people hear CAT scan and they know that machine. They know that medical CAT scan, and really what we have in our own office is
totally
night and day. And so why don't you explain the differences maybe about what we're talking about here?
Well, I think we're used to seeing pictures of the big tube or the big ring that you lie down on a table or a gantry and get kind of squeezed into this tiny space that's claustrophobic. And we worry about radiation every day, all day. In our field, because we utilize it all the time, and our patients are nervous about it, and we're nervous about it. We know its benefits, but we also respect its drawbacks. So, what we're used to seeing out there in the world are these large medical-grade CT machines. Now what we have available to us is something called a cone beam CT machine, which is a very small machine. Our dental office is not very big, and we have it in our little room now, and it looks just like a standard panoramic X-ray machine that most dental offices have had for years and years.
And that's the X-ray unit that just goes right around the head.
The one that revolves around your head. The one that is taken when your kids need their wisdom teeth removed, or your orthodontist wants to do braces for you to straighten your teeth. We utilize those images all the time. But now we're able to use the cone beam CT machine to give us a full 3D rendering of the area of interest that we have. And it allows us literally to do virtual surgery on a computer screen in 3 dimensions before we ever, get in there for real.
Yeah.
And it's an incredible technology. I saw this evolving over the years, and the images were amazing in that it allowed us to plan the case from the teeth down. Instead of saying, well, we've got good solid bone here, let's put an implant here and here and figure out how to put the teeth on top later, we would plan it out the right way, and that's, how is this patient going to utilize these teeth? We have to put them here so they can chew properly. So now, underneath those teeth that we want to restore, we've got to put the proper foundation in place. So now we can see it in 3D and plan the case out. It's much less invasive for our patients. The treatment times are much shorter. The recovery times are incredibly shorter, and the actual trauma to the patient is minimized to the point where, as you know, I place implants almost every day in our practice, and our patients get up, walk out, go back to work, go about their business, and they don't have any downtime anymore. And in our world today, it's all about convenience.
Life is fast.
Life is fast.
I think that, I have to give Kurt credit, the fact that I didn't really understand, dental implants is a great, and really, I wouldn't even say the future of dentistry, it's the now of dentistry, and it's essential, I believe, to proper patient care. And, yesterday I had a patient come in today who I just placed, a couple of dental implants on, and she is doing great today. And again, it was because we were able to plan it out on a computer screen before even touching the patient. One thing I want to clarify too for people. This isn't just about dental implants. I mean, this is really, for the information that this gives us is amazing just from an overall dental standpoint. I think I called you maybe from a course I was taking last year where I finally saw the light, I feel like, with this technology where they showed a regular, normal dental x-ray, which everybody who's listening has had. And they're looking at this tooth that looked perfectly healthy. They showed 20 dentists. Every person said it's perfectly healthy. And then they took a 3D image of this same area, and you saw this enormous abscess, an infection that was encompassing this tooth. Behind the tooth that you could not see. And that's where I realized this will be the standard of care. How can you have this at your fingertips and not want to use it to help your patients?
It's true. We talked about this earlier. I broke my leg a few years ago and had to have surgery to repair it. I know you were. And
a whole other story.
I want my surgeon to have every bit of information that he needs to go in and repair my problem before he takes a scalpel to my skin. And this is one way that we can do that. But like you pointed out, this is not just about placing dental implants. We use this for a lot of different things. Our orthodontists request these images now because they use computerized robots to actually bend orthodontic wires and shorten treatment times by as much as 1/3 to 1/2 the time that it used to take in the past. We use it to image jaw joints for the huge part of our population that has TMJ problems. And I think you and Dr. Joe talked about that a while back.
A lot, yeah.
And also I know that you talked about airway management because
Absolutely.
In our world today, there's so many allergens and so much junk in the air and things that cause our patients to have airway issues that it's very nice to be able to get a 3D scan. And I know you all talked about sleep apnea and sleep disordered breathing, and it's another tool in our toolbox that we can use to measure these problems and not guess anymore and not have to have an opinion without facts behind it.
Yeah, well, I'll tell you, when Dr. Joe gets back, he is going to hear about this. He's going to be bummed he missed this, first of all, because he's been wanting you to join the show for a while.
He's in Australia.
He is. He's not missing you that much. No. But if for those of you who are listening, this is Dr. Jeff Haddad with my business partner, Dr. Kurt Dooling. We are filling in for Dr. Kanu on his vacation, and we're talking about cone beam 3D technology that has changed our practice. And, if you want any information about this type of technology, for those of you who listen regularly, you know that my website is my baby, and you can always go there. It's RochesterAdvancedDentistry.com, or you can always call our office at 248-656-2020. We are always available for information, or obviously we're going to be putting this information on the SimpleTruthsForHealthyLiving.com, which we again are constantly building. So if you ever have any information or requests for that, please let us know. Kurt, I'm glad you mentioned the sleep apnea thing too, because just coming back from my course last weekend, and again, it's something I want to talk to Dr. Joe about, these airway people who, again, we can identify with this new technology are constant neck problem people. Neck issues because of that forward head posture. And, the way that airway goes hand in hand with neck issues, I know Dr. Joe believes in that, and I know that he wants to do everything in his power to have success with his patients. And the fact that these are intertwined it just blows me away.
I know that Dr. Joe knows the correlation between airway problems and jaw joint problems, and of course those are right there with all the neck and upper cervical spine issues that he deals with every day. So it has been a great thing to be able to work together that way for our patients.
It's good. We've seen a lot of successes. Obviously, you and I have always talked about the fact that we can't be the only heroes, but if we find somebody who can, help the patient, then that's really the most important thing. So, as far as this technology goes, where do you see our future? Where do you see our practice going, as far as what different maybe techniques and procedures are going to be benefited from it? I mean, is there something that you see as your vision?
Well, I do, but it's an evolving one because, as you know, you're only as good as what you can see. And now, instead of just normal dental x-rays, when we take a small field cone beam CT image of our patients, we are now able to diagnose things that we couldn't see before. So we can fix things before they become a real problem. And I think it's as a picture of better general health, I think this is just going to afford us some insight into that and being able to discover things that could be huge problems later on if left undiagnosed and untreated. So in that regard, I think just as an overall adjunct to our clinical skills and judgment that we work so hard to develop, I just think that this is an extra tool that's going to help us be better. But right now, what we're seeing is, and I think it's evolutionary, if you will, we see a lot of congenitally missing teeth in our patients, and we've seen that for years, and it's always been an issue where we've just said, well, gosh, that tooth's never going to come in, so we'll just treat that orthodontically and move teeth around and close those spaces. And then, lo and behold, we start to create bite problems, jaw joint problems, and airway problems. Now we can leave those spaces open. We can add implants and add teeth at an age when skeletal development is finished and really do our patients a service and keep them whole, if you will, rather than in a compromised situation. So I see that as very important. And, facts are people lose teeth, and I've always considered it, your potential for tooth loss is based on genetics, nutrition, and your own personal hygiene. So those three things together, people lose teeth. So it's our job to put them back. And it's just a great way to be able to do those things.
I think that one thing, too, that I love about this technology is how conservative you can be. And, you touched on it a little bit. Some of these things that we used to do really were full-on surgeries that were, just like any type of procedure, tough for people, and I just watched the changes in how we treat our patients and how, like you said, they just walk out that day. You come back the next day. I've talked to patients that night. I never had to take any Advil, doc. It was great. I mean, that's the stuff that you want to hear, when you're doing not only a better service, but a service that is a better experience as well. I mean, it's just so important.
Well, we should touch on the safety issues maybe a little bit.
I think that would be good. Before that, if anybody is interested in, talking about anything dentally related, you have two dentists tonight, so whether or not that's a good or bad thing, if you are interested in giving us a call here at the station, it's 313-838-1035. But no, I agree with you. As far as safety goes, your patients want to feel safe. They want to feel comfortable with you and know that you have all the tools at your disposal. And it's an amazing piece of technology.
Well, as you know, there was an article published in the New York Times recently about the use of dental cone beam CT X-rays, and
we took a lot of heat for that.
The potential dangers involved because of the radiation dosage that was involved with this type of imagery. But as it turns out, that was erroneously stated, and they were referring to medical grade CT scans, which are 100 to 300 times the dosage of radiation that we have to use with our cone beam in-office CT scan. And the machine that we have in our office now is one that we can focus the beam into a very small space. We can actually collimate or limit our beam to almost one or two teeth in a jawbone. We don't have to do the whole head like we had to do with the medical grade CTs. And so we're able to use the smallest dosage possible for all the things that we do.
I'm so glad you brought that up because I know our listeners are very health conscious, and radiation is a scary thing for a lot of people, and I think a lot of it is because they don't understand it to a degree, and there's a little hype, like in the media as far as that goes too, and in the past. Let's talk about traditional X-rays, which we haven't used in 10 years. Ours are all digital, and just from going from traditional X-rays to our digital was, I believe, 70% less radiation than even our old X-rays, which people have been using for 50 years before that, right?
Well, you know how it is when we get a new patient who moves in from out of town and they say, "Oh, I'm going to have all my X-rays sent to you." Mm-hmm. And we say, "Okay, great," because then we don't have to take them. And then we get an envelope with those little tiny X-ray films that you have to hold up to the light. And I look at those today, and I can't even believe that we used them because there's so little information contained there compared to our standard dental digital X-rays. And now we take that advance and multiply it exponentially to get the kind of information that we get out of one small field cone beam CT volume, as we call them, right. Since they're not flat plane, they're not area, they're volume now. So we see a lot more information.
No, I'll tell you, it looks like we have a caller, but I do want to touch on that of kind of some equivalents of, just to give people an idea of what type of radiation we're really dealing with. We have a caller, Carla, on the phone. Carla, how are you tonight?
Hello.
Carla, hello.
Yes.
This is Dr. Haddon. How are you?
I'm fine.
I'm great. What can we do for you tonight?
I had a question. My daughter had surgery on her gum because she had developed a cyst that was growing as a result of a root canal. And now it's been about 4 weeks. Now it's infected again. She's got to go to have it drained tomorrow. But I was wondering, should she just have that tooth taken out, or will that continue to develop because her whole jaw is swollen up? And they were concerned.
Hi, Carla. Carla, this is Dr. Doolin. I'm going to answer that question for you, okay?
Okay.
In my opinion, it's always better to keep a tooth in place. And our root canal specialists do a fantastic job of it. Some are easier than others. Some take a little bit of time and patience to get these infections cleared up. But so I would pursue that and keep going as best you can. But if it proves to be a failure, and they are sometimes, we can't fix everything, and the tooth has to be removed, then a dental implant is certainly at your availability. Mm-hmm.
How old is your daughter, Carla?
14.
14, yeah, absolutely. I mean, do everything that you can do to save that tooth, because I'm going to tell you, as good as we are at replacing teeth, nothing's as good as the original. So I totally agree with that. And it sounds like they are handling things the way that we would handle it as well. And I promise you this: any professional, when they get to a point where it becomes a hopeless cause, they're going to let you know. So I definitely think that you should continue with that as well. Hope that helps. Thank you very much, and
thanks,
have
Carla.
a great night. That was a good call. That's. I mean, I think people want to know if they're wasting their time or not, and
that's real world stuff. And I mean, in the past week, I've had that same situation more than one time. We do get failures from time to time with our root canals, and teeth break, and they're hopeless, and we have to take them out. So, in the old days of yesterday, and we would take a tooth out, let things heal, and then put a bridge in or a partial or something like that. And now, as you know, in our practice, I can't tell you the last time I took a tooth out and didn't graft the site and get it prepared to place an implant. It's just become the way we do things today. And
I think if you give people an opportunity to have something done ideal, they're going to choose it, or they're going to find ways to do it. And when you show them the pros and the cons, and you and I our goal always is just to give people the information. It's not our way or the highway. I want to give people the information so that they make the best choice for them, and then it's going to be the right choice. It's going to be whatever is right for them, whether it be based on comfort, fear, money, whatever comes into the decision-making process. But I think that having that option is key, because I don't think that people are aware that we can replace a tooth as easy as we do now. They're just not available, and they are not as educated, and they shouldn't be. And that's why we're here today. And again, that's why we want people to get the word out that there are lots of options these days. If you do have dental issues or lose a tooth, God forbid it, if that was a last case.
Well, nobody likes to hear the S word, surgery.
Oh, it's like, which one is that?
Yeah, there's a lot of those.
All right. The Christian channel.
I know that. And today, in today's world, the S words become lesson for us because it's become run of the mill. It doesn't have to be scary anymore. It's all done in office with local anesthesia. You don't have to go under. You don't have to be hospitalized. You don't have big recovery times. These people drive themselves to the office, they get the work done, and they drive themselves home. Mm-hmm. So it's not it's not life altering in the negative sense. It's obviously more of a positive move.
No, the experience that our patients have. It's a positive one. I mean, listen, it's dental work. Don't get me wrong. I mean, unfortunately, I was just in the dental chair a couple weeks ago, and Dr. Doolin behaved himself, but I didn't like being there. But you get through it. It's a good experience. You do whatever you can to make people comfortable, and that's what we really strive to do. So,
well, we've got this technology at our disposal, and it works very well for us. We do a lot of things the basic ways that we were all trained to do, but now we've got some just miraculous tools that allow us to see things and do things that we couldn't do in the past. Mm-hmm. So, but I want to point out and just remind you that I'll be leaving our practice in 2 weeks.
Well, yeah, speaking of technology,
to go do primitive.
Speaking of lack of technology, yeah, why don't you tell everybody what you're doing in a couple weeks with no technology available to you?
I'm going with my wife and our youngest daughter, Lily, to Belize with a group of people from our church. I'm worship at Lutheran Church of the Redeemer in Birmingham. I'm going to give a little shout-out to all my friends there, and Pastor Randy Schlock, who's one of my dear, dear friends, who's coming along with us, of course, as our leader.
I've heard good things about Pastor Randy.
He's a fantastic human being, and I know we're going to have a great time down there, but I will not be taking our cone beam CT machine with me.
That would be tough to travel with.
We're going to get back to the basics here and kind of do a little bit of outback surgery down there, but I know we're going to have a great time.
That is great. No, that's something that obviously make you feel good. You're going to get a lot of work done for people that can't obviously get it done any other way. And
as long as I can go and help out, I'm going to be very happy.
That's great. That is a great thing. We always try to do our charity in our office. We've had some community days in the past, and it makes you feel good. Give back to the community, and that from what I know, this is be your second or third time back to Belize, and I know that you see a need there, so that's going to be a great experience.
Yeah, it's going to be fun.
Great. So, in a nutshell, here we're going to let's wrap things up here. We talked a lot about the technology. Yep. I think the one thing I want to touch on is the safety. We never really gave anybody an idea of things, and I think that the one little stat that I love is that I don't think people realize is every day you walk around, you're getting radiation.
From the sun and from the environment.
Everything. There's nothing you can do to avoid that. And so why don't we just put it in basics here for people?
Okay. Well, if you consider your normal walking around exposure in the sunshine, just in the daylight, you're getting a certain dosage per day. And what we've done is we've equated some of these x-rays to days of exposure. The panoramic x-ray that we talked about previously, the normal x-ray that we get in a dental office, is equivalent to 2 days of just out walking around radiation. And then the normal cone beam CT that we take to visualize jaw bones in order to place dental implants is the equivalent of 4 to 10 days of out walking around. And if you want to do full head imagery today,
which sometimes is necessary,
that can get as high as between 10 and 25 days of exposure. Now, if it's my broken bone or my missing tooth, I'm getting the imaging that my surgeon needs to get me fixed. And
well, again, and the way you put it, we're just walking around getting this anyway. So I just want to make people understand that this is not scary stuff. This is very safe. And I'm going to tell you, if your professional is utilizing this information, he has your best interests in mind. And so I think we ran out of time. This goes by fast here, Kurt. It really does. Again, if anybody has any questions for us or any information that you're looking for, you can go to our website at RochesterAdvancedDentistry.com or go to our SimpleTruthForHealthyLiving.com. Our office phone number is 248-656-2020. And just want to thank Dr. Joe for allowing us to take over while he's gone. And hopefully we did his show justice. Hope everybody enjoyed it. And thanks for having us. We enjoyed ourselves.
Thanks for having me. I appreciate it.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.